Today we have an interesting story about the sudden increase in UTIs among college students. Here at Florida A&P, our school nurse has mentioned the large occurrence of students coming to her with symptoms of urinary tract infections. Here's Nurse Bree Martinez with all the facts you need to know.
We are here today with school nurse Bree. Thanks for coming in.
Thanks for having me, Kristen.
So, Nurse Bree, what exactly is a UTI?
Well, Kristen, a urinary tract infection, more commonly shortened to a UTI, is a bacterial infection normally occurring in the urethra. Although females are more likely to contract them, males can too, and it's much more severe when they get them.
So what exactly are the symptoms of UTI?
Well, the most common ones are the burning sensation while urinating and frequent urination, and a lot of times you may feel like you have to pee, but you don't actually expel any fluids when you go to the bathroom. And some other symptoms include pain in the kidneys and lower stomach.
Anatomically, what changes occur when someone has a UTI?
Well, normally blood is filtered in the kidneys and only certain substances remain in the blood, such as the red blood cells, white blood cells, platelets, and proteins. The main filtration structure of the kidneys, the glomerulus, helps to sort and separate what should remain in the blood and what should be released in the urine. Additionally, your body can only absorb so much of a substance at one time. So if you chug a gallon of water, your body has a limit called a transport maximum, and that only allows it to absorb as much as it can take at once. The rest of the water is released into the urine. When your body has an infection, you overproduce white blood cells to try to fight off the infection. Because you can only reabsorb so many of the white blood cells, you often urinate white blood cells when there is an infection in the body.
How does someone contract something like this?
Well, it's very easy actually. Something as simple as staying in a pair of underwear for too long, like too many days. Other ways someone can contract a UTI is from not urinating after sexual intercourse.
Babe, where are you going?
I have to pee!
Or in females, wiping back to front. Or from having a catheter.
What can people do to treat a UTI?
Immediately visiting your doctor is the best route. Bacterial infections like these can spread to the kidneys, which can be very serious. Over-the-counter medications are available if you can't see a doctor right away. Some common prescribed medications include ciprofloxacin and Keflex.
Thank you so much for your time, Nurse Bree.
Thank you for having me.
Now back to you, Mary Jane.
Thank you for that useful information, Nurse Bree. We'll see you next time on the Florida A&P Broadcasting System.